Hello, this is Dr. David Green, CEO of the California Pain Network. The topic today is radiofrequency ablation for back and neck pain treatment. The scope of the problem is huge. Back pain affects 90% of Americans at some point in time. It's the second most common reason people see a doctor, just behind the common cold. Leading cause of disability in those under the age of 45, and back pain is seen in up to 40% of those who undergo back surgery. That's known as failed back surgery syndrome. Neck pain affects about 10% of the population at any one point in time, with up to 45% each year. 50 to 70% of individuals have neck or shoulder pain at least once in their lifetime. The cervical and lumbar facet joints, you can see in imagery to the right, they're about the size of a thumbnail. They're on both sides. So you have one here on the left, one on the right, the left, the right, at every level. They combined provide excellent range of motion for the spine, but they're prone to arthritis just like other joints such as the hip or the knee. 45% of the time a person's back or neck pain is due to a problem in these facet joints. We really don't have a successful joint replacement like we do for the hip or the knee. This is a much more complicated joint. The diagnosis of facet joint related pain is made by looking at history, a physical examination, performing x-rays, CAT scan, something to look at the anatomy there. Here's an example. This is a CAT scan of a slice through where you see a vertebral body here. This is the spinal canal. This is a facet joint, and this is a facet joint. These actually look nice. See how the joint is not ratty at all? It looks nice and smooth there, as opposed to this one, where you have the joint space being obliterated. You have excess of bone formation, these bone spurs here, okay? That's facet joint arthritis. Now, interestingly enough, this person may have no pain, and this person may have horrific pain. It doesn't always correlate with the imaging studies. So once you've done all that, the history, the physical, the imaging studies, it still can be a coin toss. Severe pain may be accompanied with very little arthritis on imaging studies or vice versa. Even the best trained spine doctors, fellowship trained, board certified, spine surgeon or whatnot, they're wrong half the time. That's what the studies show. So diagnostic injections can help with medial branch blocks, where you put a little numbing medicine around where these little nerve endings supply sensation to the joint. Those can be helpful. Or you can put medication right into the joint. That's called a facet block. Okay. And if the diagnostic injections have a positive result, some insurance companies say 50% pain relief, some say 80%, then a person can be a candidate for radiofrequency ablation. Now, different insurance companies have different ideas of what a positive result is. Some say 80% pain relief on 2 separate occasions before they'll approve a radiofrequency ablation. It's going to vary. So for a medial branch block, despite the fact that it's an excellent indicator of facet joint involvement, it in and of itself can provide pain relief for 3 months on average. So it's both diagnostic and therapeutic. So radiofrequency ablation, there's actually a lot of names for it. Radiofrequency neurotomy, medial branch neurotomy, medial branch thermocoagulation, denervation, lesioning, then it shortens to RFA, RF procedure. It's all the same thing, there's just a lot of names for it. 5 facts about radiofrequency ablation. The current used is the same wavelength as radio signals, but there is no FM radio involvement. An RFA can actually have more pain afterwards, and then before it gets better, so it can get worse before it gets better. Pain relief may last for upwards of 2 consecutive years. Unbelievable. You do need a diagnostic injection prior, as I mentioned, and it's been a revolutionary treatment for back and neck pain. There's very few procedures that provide that long-term pain relief. And what exactly is happening here? Well, here's what we're talking about. You have a nerve root that comes out, and then these little medial branches, they're called, that come off and supply sensation to the joint. If you look at this joint below, you're actually getting a little bit from above and some from below. So it's 2 sensory nerve supplies. These little nerve endings, they don't do anything for motor function. So if you deaden them, no big deal. Okay? So you have the radiofrequency catheter that comes in and deadens those little medial branches that comes down. Therefore, you don't get the sensation to the joint and you get pain relief. So the procedure itself involves IV sedation typically. You don't have to have that, but it helps. These catheters are placed under fluoroscopy, which is a real-time form of X-ray. And once they're in place, the pain doctor will use an initial stimulation to make sure it's not too close to an actual nerve root. So if the leg jumps or the arm jumps, depending on where you are, it'll need repositioning prior to the procedure being performed. Usually it's 80 degrees Celsius for 90 seconds straight. That can deaden the medial branches. It's outpatient. It takes under an hour. But depending on the nerves being worked on, those settings may be altered a little bit. Okay, but that's the usual. What are the results? Well, studies show pain relief upwards of 2 years. Significant and longer lasting pain relief compared to steroid injections. Gives a much greater range of motion than before. It can decrease the use of pain medications, and it has a short recovery time. But complications include potential increased pain for a week or two due to spasms prior to relief. So as mentioned, it can get worse before it gets better. If the nerves are only partially coagulated, if they don't fully deaden them, this happens less than 5% of the time, but you can have increased pain for months. Okay, you can have some slight numbness of the skin over the procedure site, no big deal. Spinal cord trauma, that's a big deal. Thankfully, it's extremely rare. The average pain relief in one study was 472 days. This is about 15 months. Okay, that is amazing, and like I said, it can be upwards of 2 years. So they've done studies looking at a repeat procedure in the back or the neck and showed that the results are typically the same. So that's great. If it wears off, you can just have it repeated. The top non-operative pain management is offered through the California Pain Network. Throughout the state, there are clinics in San Diego, Orange County, LA, Sacramento, San Francisco, and in between. Over 50 insurances are accepted with over 25 treatment options. Obviously, one of those is going to be the radiofrequency ablation procedure. Overall, average for pain relief is 90% success. Board certified and award-winning pain doctors are in the network. Visit us online at californiapainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops here.